Hi everybody and welcome to our lecture on chest anatomy. So the anatomy of the chest is going to be divided into three different sections. We have the bony thorax, which is going to be the protective framework, the respiratory system, which is going to consist of the lungs and airways, and then lastly we have the mediastinum, which is going to be the space in between the lungs. Looking and diving a little bit deeper into just that bony thorax area, the bony thorax is going to be divided now into the following. The sternum, which has three divisions. We have the manubrium, the body, and the xiphoid process. 2 clavicles, 1 on each side. 2 scapula, 1 on each side. 12 pairs of ribs, and then 12 thoracic vertebrae. You can see on the right hand side a picture that shows every little piece of the bony thorax. Looking at the respiratory system, the purpose of the respiratory system is going to be exchange gas substances between air and blood. The respiratory system is divided into 4 different divisions. We have the pharynx, the trachea, the bronchi, as well as the lungs. Something to note, an important structure of the respiratory system is going to be the dome-shaped diaphragm, which is the primary muscle for inspiration. As the dome moves downward, it increases the volume of the thoracic cavity and vice versa, which we will learn specific breathing instructions for a patient when we're doing x-ray exams. The pharynx serves as a passageway for food and fluids as well as air, making it common to the digestive and the respiratory systems. It can usually be found between the nose and mouth above, and the larynx and esophagus are going to be just below. It usually is approximately 5 inches in length and consists of 3 different divisions: the nasopharynx, the oropharynx, and the laryngopharynx. The esophagus, on the other hand, is going to be part of the digestive system that connects the pharynx with the stomach. The larynx, which is the patient's voice box, is located in the anterior portion of the neck, suspended from a small bone called the hyoid. Something to note, the hyoid bone is not a part of the larynx. Think of it as the organ that serves pretty much the patient's voice. Sounds are made as air passes between the vocal cords located within that said larynx. The largest and least mobile cartilage is the thyroid cartilage, which consists of 2 fused plate-like structures that form the wall of the larynx. You'll see these cricoid cartilage, which is a ring of cartilage that forms the inferior and posterior walls of the larynx. And then you'll also see the epiglottis, which is a uniquely shaped cartilage which resembles a leaf with the narrow distal stem portion attached to the part of the thyroid cartilage. This is what flaps down and covers the trachea during swallowing. Moving on to the trachea. So the trachea pretty much connects the larynx to the main bronchi. There are roughly about 16 to 20 C-shaped rings of cartilage that are embedded into the anterior wall. It keeps the airway open to prevent it from collapsing during expiration. So the trachea is going to bifurcate at the carina to form the right and left primary bronchi. The carina is a specific prominence of the lowest tracheal cartilage and marks the division of the trachea into that right and said left bronchi, which is shown in front of you. The right bronchus divides into 3 secondary bronchi, and the left bronchus divides into 2. The right lung contains 3 lobes, where the left lung contains 2 lobes. The secondary bronchi then continue to subdivide into bronchioles, and then each small terminal bronchiole terminates into a very small air sac called alveoli. Moving on to the patient's lungs. As noted, the right lung has 3 lobes. The superior, the middle, and the inferior are going to be divided by two deep fissures. The oblique fissure separates the inferior and middle lobes, whereas the horizontal fissure separates the superior and middle lobes. The left lung is divided into two different lobes, the superior and the inferior, separated by one single deep oblique fissure. The lungs are composed of a light, spongy, highly elastic substance called parenchyma. Each lung is contained in a delicate, double-walled sac called the pleura. The outer layer of this pleural sac lines the inner surface of the chest wall and diaphragm, which is called the parietal pleura. And then the inner layer that covers the surfaces of the lung is called the pulmonary or visceral pleura. Last but not least, the space between the double-walled pleura, called the pleural cavity, contains the lubricating fluid that allows the movement during breathing. So it pretty much allows your lungs to move up and down during inspiration and expiration. So looking at some image anatomy review, starting out with the apex, that's going to be the rounded upper area above the levels of the clavicle. So again, right here, apex, apex. The carina is going to be the point of bifurcation. Again, this is the lowest margin of the separation of the trachea into the right and left bronchi. This is going to be right here where that letter C is. The base is going to be the lower concave area of each lung that rests on the diaphragm. So yeah, this is base, base. The costophrenic angle refers to the extreme outermost corner of each lung where the diaphragm meets the ribs. So this is going to be a costophrenic angle, and this is going to be a costophrenic angle. The hilum is going to be the central area of each lung where the bronchi, blood vessels, lymph vessels, and the nerves enter and leave the lungs, which is going to be seen on this lateral image. It's that circle right here. Diving a little bit deeper into the mediastinum, this is the third section of the anatomy of the chest. It's divided into four different structures: the trachea, the esophagus, the thymus gland, as well as the heart and great vessels. The only thing I really want you to know about the heart and the great vessel is that the heart and the roots for the great vessels are enclosed in a double-walled sac called the pericardial sac. The great vessels of the mediastinum are going to be the inferior vena cava, the superior vena cava, the aorta, as well as the pulmonary arteries and veins. That's all I need you to know.